Parents, if your kids play sports, you've probably worried about them getting a concussion. Research shows as many as 3.8 million sports and recreation-related concussions happen in the U.S. each year. Here's Dr. Joubin Mehta with important advice on protecting children and knowing the symptoms.
So concussion is a traumatic brain injury to the brain. Think of it as a bruise to the brain. When you have a bruise to the brain, it alters the way it functions, and what it means is that you can have neurological symptoms. What are those? You can have dizziness and headache and vomiting and change in behavior, irritability, blurry vision. So it's important to recognize these symptoms very early and to seek medical attention right away. So the simplest way to prevent a concussion in your children is to wear protective gear. You wear a helmet if you're bicycling, if you're playing football, or doing any activity that poses a risk of a head injury, to wear pads or any sort of protective gear on the head that can help them from having a serious brain injury.
Coming up, we'll explain what the recovery process is like after a concussion. That's your Medical Minute.
Today's Medical Minute brought to you by Hospitality Health ER.
Young athletes may want to get right back out on the field after an injury, but Dr. Joubin Mehta explains why the brain needs time to heal in our Medical Minute.
So there's been a great movement recently about when to resume regular activities and about concussions in general. If a child has had a concussion, it's very important to let the brain heal. Just like any other part of the body, it needs time to heal. So if the brain has a bruise or a concussion, it is very important to resume regular activity slowly. That includes physical activity and cognitive activity. So if a child is jogging or playing or even reading a book or watching a TV show and have a headache or dizziness or they're nauseous or they're having a difficult time concentrating, it's better to just rest the brain, take it easy, and let the brain heal. And that can take several weeks to happen. Rushing a child back into a particular activity that may pose a greater risk of a head injury, and if they get that second head injury, the second or third bruise can cause permanent damage, and that's the biggest thing you want to avoid. Secondly, some patients, whether they have one concussion or two concussions, can get post-concussive syndrome, and that is the same or similar symptoms of a concussion, and those are persistent headaches, memory lapses, dizziness, irritability, change in behavior. So in the end, if you suspect that your child had a concussion, you must seek medical help as quickly as possible.
Dr. Mehta says it's important for a physician to rule out underlying issues like bleeding of the brain or a skull fracture. And that's your Medical Minute.